I'm really happy to be here today introducing you to the Tacoma-Pierce County Health Department, our GIS Online based COVID case and contact management solution. TPCHD is located in Washington State within Pierce County, Washington. It's the local health jurisdiction for Pierce County, where we have approximately 905,000 residents. Last summer, we were presented with a challenge in dealing with our case and contact data. The LHJ, TPCHD, and the state of Washington did not have any digital solution for case and contact management, for database management. And so we had most of our work being done on paper-based data collection systems being fed into Excel files. We had high case counts. We were dealing with 7 to 8 different database systems that were collecting, reporting, and monitoring data. We had very detailed required workflows from both federal and state requirements. And we were hiring up to 100 plus more employees and having to train, relocate current employees, put them into remote conditions and increase security for technology and short turnaround times for going live with this system. I'm going to step you through some of our workflow processes. Here's a high-level view where we can just kind of get an idea of what it was like to take our data, receiving positive test data from the Department of Health for Washington State, and then moving it through our case and contact management investigation system. The state would come through, be assigned to a case investigator. They would interview the case, set up daily monitoring for the case, close that after review, and then move on to the contact monitoring. If we dive down into a mid-level review, you can see that it's much more complex than it might appear. There are multiple teams working together to transfer data back and forth between the teams. We have an outbreak investigations team, we have group supervisors, team leads, investigators, and then we have our public health branch that has to report out to other components and groups within the Tacoma-Pierce County Health Department. And all of this also has to get reported to the public and back to the State Department of Health. Here's a smaller level view of one of our teams, our research and documentation team. And they are the team that takes our data in daily, reviews it, looks for any lab database issues, addressing issues, looks for duplications within our database, et cetera. And then that data gets pushed out to the rest of the team for review. So with the complexity of the challenges of being a data solution that was paper-based and pushed into Excel and needing to report back out, we had the opportunity to review and interview Tri-County Colorado Health Department and investigate a system that we saw demoed by them. Everybody at TPCHD was very excited about this potential solution. And so after probably about 6 weeks of research to see whether or not it was the right solution for us, we went ahead and decided to implement this. And we went from implementation of development to being live with the system within 4 months. We have over 150 people at one point in time that have been using the system on a daily basis. And we now have gone from a paper-based solution to a digital solution. We also have post-live system implementation help desk system processes that were implemented. And our system itself includes 45, now 46 actually as of yesterday, surveys, 29 dashboards, 4 web apps, 5 maps that feed into those web apps. And then we have 5 layers that feed into our main hosted feature service with 3 relationship classes between all of those different components. As you can see, it's a pretty robust system. And we have a lot of people actively using it daily. So I want to show you just some really brief overview of some of the dashboards that we use. We use a lot of operations dashboards. And this one here you can see is this down on the bottom right hand side is our main data entry point for our dashboard. So these are just links that take you into other parts of our system. Some of these are dashboards, some of these are web apps or web maps. This up here is our main case investigation dashboard. We do have PHI, so we have blacked some of that out, as you can see here. And an investigator can open up their dashboard. They can select their name here on the left-hand side. It's going to then populate a list of cases that are assigned to them to investigate. And when they select one of those, then it populates a series of tabs over here that are embedded surveys right onto the dashboard. So they can interact while they're talking with a person about their case and they're interviewing them. They can then input that data into these surveys, hit submit, and then it populates into our database. We have a workflow process that is built into the system through flags within the database itself. And it then helps move that data from one dashboard to the next through our workflow process. These dashboards are for our research and documentation. So when those data records get loaded once a day from the Department of Health, we grab that data, the epidemiologists review it, they flag it, we then load it into our system, and then our R&D team goes ahead and researches it and pushes that out to the rest of the team. We also over here have this bottom right-hand side is our deduplication dashboard, where anything that might be potentially a duplicate record in our database gets flagged and moved over here and can be researched further. And then we also have team lead dashboards, group supervisors dashboards, because they're managing the workload, like you can see here in the middle in the orange, from our staff from a day-to-day basis, and then they're helping to do final review and closing out our cases and also our contact information. Our outbreak investigations process is very complex. We can be sometimes investigating a facility that had an outbreak for up to 3 months more. Sometimes it's less. And there's a lot of different components that they're working with. They're working with cases, contacts, and facility information. We have multiple types of facilities. So there's so many dashboards built into this that we actually can't even see the tabs because there's not enough room to show all the different tabs. So this dashboard itself has is also moving the data around from point to point. The data comes in over here and then it gets pushed up over here. And again, all of these are interactive components where you might select one part of the dashboard on a list, and then it will populate and change another component on the dashboard. From all of that information, we can then have internal and external reporting that happens. We have, these are our internal reporting metrics that are on 2 different dashboards. This one up here on the upper left shows information on how quickly are we actually achieving that goal of investigating these cases and making contact with these individuals that we need to be interviewing. And then over here on the bottom right-hand side, we have information that just shows how many cases have we had, how many contacts, some demographics about those individuals, and just some general metrics. So I really like this slide because it shows what we started with on the left-hand side. We had a lot of things happening, a lot of moving parts, a lot of different systems just talking back and forth to each other and not connected, passing information, sometimes duplicating effort. And by simplifying and moving into an ArcGIS Online-based solution, we were able to centralize the database, and now we can get data from the state, push it out to the state systems, and then back into our system and out to community partners and also to our active monitoring system. What's next? Well, next we are actively moving to our internal ArcGIS Enterprise Standard Portal system, where we will be moving all of these files behind our firewall and then building additional systems into place for us. And we'll be using some FME for that. And then also some internal support from our IT additional that we don't have now when we're using ArcGIS Online. Additional ArcGIS Online solutions that we have currently in place internally and both externally is we have public facing case reporting, vaccine reporting dashboards, public mapping of testing locations. And then we also have internal maps and apps that are set up for COVID response planning for, say, testing sites and vaccine clinic locations. Over here on the bottom right is our vaccine reporting dashboard that's new within the last 2 weeks. And over here on the left is a dashboard that has daily metrics for our public. Up here on the upper left-hand side is our dashboard that shows how we are with our spread of COVID within Pierce County, Washington. And this is a public metrics dashboard based off of where we are within the phases and meeting the state requirements for phases to reopen. And bottom right-hand side, this is one of our public-facing apps that shows where we actually have mobile testing sites and static testing sites. So if anyone's looking for those. So as you can see, it's a pretty big system that we have developed and that we're maintaining. And it took a lot of people to get this together. So we had our project managers, lead epidemiologists, we had business managers to help with staffing, with training. We had every part of our team at some point got to test the system. We had a process where we had, I think, 3 weeks of testing in place. We had our IT support and our GIS staff. And then we had incredible support from Esri through the entire development and going live process. And even now they continue to support us with the solution. And a huge thanks to Adam and Gabby at Tri-County, Colorado Health Department for all of the support and really helping us get started. Had we not had that platform to launch off of, it would have taken a lot longer to get going. And we'll continue to build off of this. We have weekly enhancements that we do, and we use our help desk ticket system for that process. I want to thank you for allowing me to be here today to show this to you. If you have any questions, here's my contact information. I look forward to talking to you.